we will teach you how to identify some important abnormalities. Many abnormalities cannot be seen by ultrasound or are difficult to see. Therefore, we do not expect you to identify all abnormalities on ultrasound. Some babies you scan may be born with abnormalities that you did not see on ultrasound. This does not mean you made a mistake. We are also not able to teach you in this course how to identify all fetal abnormalities. If you identify a fetal abnormality, always refer to the hospital, even if you are unsure. It is more important to make the right referral than the right diagnosis. These are the abnormalities which we will discuss in this lecture. Anencephaly, exencephaly, which is an early stage of anencephaly seen in younger fetuses, ventriculomegaly, hydronephrosis, cystic hygroma. Please pause the video now to practice saying each word with your instructor. First, we will discuss anencephaly. Anencephaly is a condition in which the skull and much of the brain is missing. This is very rare. There is no chance of survival for the fetus. The cause is unknown. A fetus with anencephaly appears similar to the image on the right, which lacks a brain and part of the skull. On ultrasound, you will see these features: no visible skull, no brain above the level of the orbits, which are the eye sockets. The eyes appear unusually prominent, as if they are bulging out like that of a frog. There is often polyhydramnios, which means there is too much amniotic fluid. This is an image of a fetus with anencephaly. You can see that there is no brain or skull above the level of the eyes. The skull does not cover part of the brain. The eyes appear quite prominent or stand out. Here is an example of a normal fetus and one with anencephaly, as seen by ultrasound. Please pause the video now to identify the signs of anencephaly in the image. On the left, we see a normal fetus with a skull and brain. On the right is an image of a fetus with anencephaly. Notice that the eye socket, or orbit, appears prominent and that there is no skull above the level of the orbits. This is another example of a fetus in profile with anencephaly. Please pause the video now to identify the fetal body, face, and eye. Here we have labeled the eye socket or orbit, which appears more prominent than usual, meaning that it stands out. Notice that there is no skull or brain above the orbits. This is a transverse image of the prominent orbits or eye sockets in anencephaly, which appear similar to frog eyes. Now we will discuss exencephaly, which is an early stage of anencephaly seen in younger fetuses. In this condition, there is no skull, but some brain tissue is visible. The brain tissue degenerates over time, leading to anencephaly. There is also no chance of survival. Please pause the video now to practice saying exencephaly with your instructor. This is an example of exencephaly, There is no skull, but some brain tissue is still present. Please pause the video now to have a participant point out the brain tissue, fetal face, and fetal spine. Here we have labeled those structures for you. Notice the disordered appearance of the brain tissue because there is no skull. This brain tissue has likely begun to degenerate, and soon the brain tissue will no longer be visible, and the condition will be called anencephaly. This is a different case of exencephaly. Again, there is no skull and some brain tissue is present. Please pause the video now to point out the brain tissue, fetal orbit, and body. Here we have labeled those structures for you. The key to identifying exencephaly in this image is to see that there is no skull and some brain tissue is still visible. The next anomaly that we will discuss is ventriculomegaly, which means an enlargement of the spaces inside the brain that contain cerebrospinal fluid. Cerebrospinal fluid, or CSF, cushions the inside and outside of the brain. Inside the brain, the CSF is contained within spaces called ventricles. Please pause the video now to practice saying ventriculomegaly with your instructor. Recall that we identified the lateral ventricles in a prior lecture because they are important markers for us to get a proper scan to measure biparietal diameter for fetal dating. The lateral ventricles are best seen at level A. Here are two images of normal ventricles. The ventricles contain cerebrospinal fluid, and so the ventricles appear black. Within the ventricles, there is echogenic tissue that makes the cerebrospinal fluid called the choroid plexus. Here we have labeled the ventricles and choroid plexus that fill a part of the ventricles. The calipers measure the size of the ventricles. Normal ventricles are less than 1 centimeter in size. With the condition called ventriculomegaly, the lateral ventricles become enlarged and wider than 1 centimeter in size. This can be caused by a blockage in the ventricles or by a loss of brain tissue. There are other causes as well, such as infection. Lateral ventricles are located above the thalamus and are normally small. In these images, the ventricles are much larger than 1 centimeter, which we call ventriculomegaly. Here, the red calipers mark the width of the ventricles. In these images, there's also ventriculomegaly with very enlarged ventricles, marked by the red calipers. The ventricle on the left measures 2.4 centimeters, which is much larger than the normal value of less than 1 centimeter. Notice how the choroid plexus seems to dangle into the ventricle because there is so much fluid. This is a typical appearance for the choroid plexus in ventriculomegaly because so much fluid surrounds the choroid plexus. Now we will discuss a different type of problem in the fetus that you can see on ultrasound, related to a blockage within the urinary system. As a result, urine may back up anywhere along the urinary system. There are many causes of blockage. Babies with urinary blockage may need surgery, or other treatments after birth, so this is an important abnormality to identify with ultrasound. In this diagram, we see a normal urinary system on the left side. Urine is formed in the kidneys and then travels down small tubes called ureters to the bladder. On the right side, we can see what happens when a blockage develops in the ureter. Urine begins to back up into the kidney, making it swell. This is called hydronephrosis. The area where urine collects in the kidney is called the renal pelvis. Here we show how normal kidneys appear on ultrasound, indicated by the red arrows. The top image is transverse, and the lower image is sagittal. Can you identify the urine in the kidneys? Please pause the video now to give participants time to identify urine in the kidneys. Here we have labeled the urine inside the kidneys with arrows. It is normal to see a small amount of urine in the kidneys. Because urine is fluid, it appears black. These images are normal. This is how kidneys will appear on ultrasound when hydronephrosis is present. These kidneys are blocked, so they are filled with urine, which will appear black. Hydronephrosis usually involves dilation or enlargement of both the lower and upper regions of the kidney. There are several things to notice about these images. First, notice the dilated renal pelvis filled with urine. How do we know that we are looking at a kidney? The small pyramids or ridges that project into the dilated renal pelvis are typical of the kidney. These ridges may disappear over time as pressure from the blockage slowly destroys the normal kidney tissue. Finally, notice the amount of kidney tissue or parenchyma that remains and surrounds the dilated renal pelvis. There is much less kidney tissue remaining in the left image than in the right image. In both images, the kidney tissue remaining is much less than in a normal kidney. Now notice that there is another fluid-filled structure in the right image. Can you guess what it is? Please pause the video now to discuss in the group. The answer is that this is the bladder. Notice the smooth contour of the bladder and the lack of pyramids or ridges that we see in the dilated kidney. Now let's review how to determine if a dilated structure on ultrasound is the kidney, the bladder, or even the fetal stomach. First, fluid collections in the kidneys usually appear near the spine. If you see small pyramids or triangle-shaped structures around the edges of the fluid collection, this is a kidney.